Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. I'm joined by Lanette Siragusa, Chief Nursing Officer for Shared Health. Today we are announcing 5 additional deaths due to COVID-19, all from the Winnipeg Health Region. I want to extend my condolences to their families and loved ones and caregivers. Our current 5-day COVID-19 test positivity rate is 10.7% provincially, 11.8% in Winnipeg. As of 9:30 a.m., 118 cases of the virus have been identified, bringing our total number of lab-confirmed cases in Manitoba to 25,244. We're starting to see our case numbers coming down, and while our restrictions are due for review, we need to ensure that this is not the time that we relax our efforts against this virus. Our test positivity rates are still quite high. Our hospitalization and ICU numbers are still high. And it's also too early to know the effects of what gathering over the holidays may have had on our numbers. So it's premature to right now determine any changes to our restrictions. We're going to continue to monitor the impact of those holiday gatherings throughout this week, and we haven't yet landed on the new restrictions. Right now, we all need to continue to focus on those fundamentals to protect yourself, your loved ones, our neighbors, our co-workers, our community safe. And certainly people too are asking people to stay home as much as possible. Certainly stay home when you're sick. Go for testing when you're sick, even with mild symptoms. But very important to stay home when ill. We have yet to identify a case in Manitoba of the new variant seen in the United Kingdom. It has been found in other parts of Canada. We're advising all international travelers to be tested for COVID-19 upon arrival in Manitoba, even if they are not showing symptoms. Certainly all Manitobans who show symptoms, even mild symptoms, should go for testing. But people returning from international travel should be tested upon arrival into Manitoba, and again on day 7 upon their arrival, even if they remain asymptomatic. We're just wanting to ensure all international travelers are testing. And remember, this testing is in addition to other requirements under the Federal Quarantine Act. So international travelers are still required to quarantine for 14 days. And so this doesn't change that. This is in addition to that. Returning travelers should make an appointment with a provincial testing site or visit a drive-through test site. We're asking all these returning travelers to ensure they make the testing sites aware of their travel plans so we can monitor for positive tests and returned travelers. Just like in any situation, if someone who is asymptomatic tests negative but later develops symptoms, those individuals should be retested, self-isolate and retest. Those individuals who have tested positive COVID-19 have had close contact to an international traveler should identify this contact to public health as well. We're encouraging Manitobans to stay home as much as possible, but donating blood is still very essential, and donations are especially needed in and around the holidays. So please consider booking an appointment through Canadian Blood Services to donate blood to save a life. Reminding Manitobans that our contact tracing calls may come from a local 204 number, may come from a 1-888 or a 1-855 number, because Statistics Canada, Red Cross, and automated calls are helping us do this contact tracing. So please be sure to pay particular attention to your phone calls, even if they are from a different area code. It could be public health calling you with important information. So thanks again. Happy New Year to Manitobans. And I'll pass over to Lanette.
Thank you. Happy New Year, everyone, and good afternoon. So this morning there were 340 COVID patients in our hospitals throughout the province, and this includes 245 who actively have COVID, as well as 95 who are no longer infectious with COVID but still require inpatient acute care. As of midnight, our intensive care units were at 157% of what our normal pre-COVID capacity would be, and there are 113 patients admitted to critical care. 41 of these patients have COVID or are just past their infectious period but still very sick. 30 of our 65 patients who are on ventilators this morning have COVID, and this includes 4 COVID patients who are no longer infectious. The hospitalization numbers involving patients with COVID appear to be stabilizing now with the decrease in active cases, but they still are higher than what we would normally be without COVID, and it continues to place a strain on our staffing situation and the healthcare system as a whole. Especially in the critical care areas, we are relying on that overcapacity to be the care provided by the surgical nurses, the team that works within the surgery program. So as we see the numbers come down, we are hopeful that the critical care admissions and medical admissions in hospital will also start decreasing, at which time we can talk about gradually increasing surgical procedures. As you are aware, we still are doing emergent and urgent cases, but it's our goal to start doing those elective and non-urgent cases as soon as possible, because we know people are relying and waiting for that, and quality of life is impacted without having those procedures. On the personal care home front, there have also been some stabilization happening and over the last while, with a decrease in daily counts reflected. 25 of the 43 outbreaks that are currently identified in personal care homes throughout the province have 2 or less active cases. So the numbers are starting to come down. There are 16 outbreaks that have been identified that actually have 0 active cases, and that reflects an incubation period that we are continuing to watch for. So we identify them as outbreak, but they don't actually have active cases at this time. In total, there are 399 active cases within Manitoba's personal care homes, and in Winnipeg specifically, there are 103 active cases involving care home residents and staff. So that's 55 active cases for residents, as well as 48 active cases within staff. There still is lots of work to do on this front. We are definitely not out of the woods yet, but I did want to thank everyone who's been involved in stabilizing the personal care home situation, just through the cleaning and all the work that's been done to minimize the spread of the virus, as well as all the healthcare workers who have stepped up to support these teams, these personal care home teams. The COVID situation means that people who are in long-term care are much more, they have higher acuity needs, so we have been changing the nurse-to-patient ratio and the healthcare aide to patient or resident ratio. So it has required more resources than we previously had, and we just want to say our thanks and sincere appreciation to everyone who's been helping, and it's looking like it's working, so thank you so much. In the hospital area, Public Health is reporting that there are 15 outbreaks at 11 healthcare facilities or hospitals throughout the province, and these outbreaks include 45 active cases. The hospital, Beausejour Hospital, had a temporary suspension of emergency services. That is now over, and the emergency department reopened today at 8:30 this morning. As well, there was an outbreak in the PA at St. Anthony's General Hospital. It has now been also declared over the weekend. And finally, I just want to give an update on the VCOP initiative, the pilot that we have underway at the Health Science Centre. VCOP is an acronym which stands for Virtual Outpatient COVID Monitoring. And this initiative supports monitoring patients who have COVID in the home with the support of a specialized team at the Health Sciences Centre. So lower acuity patients are able to connect very regularly with their specialized team while they are either self-isolating or following discharge from hospital. And it is able to support people who are on oxygen as well, as that is sometimes one of the lingering effects of COVID. And a physician will monitor on a regular basis the severity of the patient's symptoms at regular intervals. And if the symptoms seem to be worsening, a paramedic may be dispatched to the patient's home or wherever they're staying, if it's an isolation center, and they can monitor vital signs, they can do blood work, and if the symptoms are severe, then we can coordinate transfer directly to the hospital or the emergency department and meet those escalating needs. So the pilot was launched 3 weeks ago, and 14 patients so far have been enrolled in this pilot project. 3 of them are active COVID cases. And when you look at what we're starting to see now is by supporting these patients in the home where they may have been in the hospital, we have been able to save 35 patient days, patient hospital days, as well as allow them the comfort of home, being closer to their familiar surroundings, non-hospital setting, and free up the resources in the hospitals. So our goal is to expand this program now that the pilot has worked out some kinks and figured out some pathways. We're going to expand the project to HSC's emergency department later this week. And as capacity will grow, we're going to look at having this as a province-wide initiative. There was a request for proposals issued a few weeks ago to support this work, and we anticipate news on who has been awarded the work to be announced in the near future. And so with that, we can open the line to questions.
Thank you. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from CJOB, Will.
Good afternoon and Happy New Year to you both. Dr. Roussin, in a news bulletin earlier, the province says cases of the new COVID variant are being investigated and that testing takes additional time. So I'm wondering, is every single test now being tested for this new variant, and how much added strain is that putting on the system?
Yeah, not every single positive test. We're looking for positive tests that were related to travel, and so doing the molecular genotyping on that. And so as far as strain goes, it's not straining necessarily our public health response, the public health testing. It is separate to that. Obviously any additional work has some impact, but it's not putting additional strain on our testing sites or the testing capacity at this point.
Okay. And with the nicer weather out, we're getting questions from people who would like your advice on mask wearing in situations where it isn't exactly mandatory. So, for instance, there's a lot of people out this weekend skating or walking trails here in the city. What would be your advice for people in those situations?
Yeah, I think the advice is to wear a mask whenever possible. So it's not required in outdoor situations, but we know that putting on and taking off your mask is often a time where you put yourself at a bit of risk for inoculating yourself. So, I think hand washing, wearing a mask whenever you can is just good advice.
From the Winnipeg Sun, Josh.
Good afternoon, Dr. Roussin and Lanette Siragusa. Happy New Year. Just earlier, Dr. Roussin, you said it's too early to predetermine any changes to restrictions that haven't landed on any new restrictions yet. When we look at the health orders expiring on the 8th, are we just looking at pretty much a straight extension of those health orders for a couple weeks? Or should we actually expect some changes to those health orders beyond the Winnipeg Jets being cleared to play hockey?
Yeah, and so we haven't landed on anything specific at this point. In the upcoming days, we'll be discussing further what that will look like, but we haven't landed on anything definite yet.
And looking at the case numbers, they're falling. Where do you see these case numbers being driven right now? Are these still in the PCHs? Are they still in the more vulnerable communities? Where are you seeing these current cases being driven?
Yeah, and so certainly in the Winnipeg region, we're seeing cases again in the lower income quintiles, and in the Point Douglas, the downtown, the Seven Oaks regions. So still looking at approaches there. We've have some additional testing in the area, still looking at more approaches. But in Winnipeg, that's still the disproportionate effect in those regions.
From CBC Radio Canada, Gavin.
Hi, Dr. Roussin, Gavin from Radio Canada. I was just wondering about the testing for international travelers. Is this going to be obligatory and mandated by the province in a health order?
It's not in a health order. Right now, it's our messaging to people returning to Manitoba from international travel to be tested as soon as you arrive in jurisdiction, as well as 7 days later if you remain asymptomatic. Certainly anyone who's symptomatic should be tested as soon as possible and isolate. And the big message here again is that this is in addition to the quarantine requirements. So in returning international travelers, most of them are required to quarantine for 14 days. This is in addition to that.
So you don't have any intention of forcing people to do this or making it a rule?
For the testing, we don't have that as of right now in an order. Under the Quarantine Act, the Federal Quarantine Act, the quarantine period is a requirement.
From CBC Manitoba, Bart.
Hi there, Doctor. When will the vaccination teams be going into personal care homes? Which ones, when, and how many people in each personal care home in the first day or week? Just tell us everything you can tell us about the personal care home vaccination program, please.
Well, for the personal care homes, there are plans to start as early as next week. In those facilities, as far as how many will be vaccinated on every day and the names of where they're going to be starting, I don't have that. I think the vaccine task force has the algorithm on the approach, and our approach is really based on a balance of the highest risk settings and the ability to get the most vaccines in the most arms in the shortest period of time. So they have the algorithm in place, and as far as more specifics go, then probably Dr. Reimer will have more on Wednesday for you.
Okay, thanks. And obviously, there were no vaccinations taking place over the weekends. There has been some suggestion that we're trying to independently verify, but Manitoba is actually the worst in Canada at getting vaccines in the arms of Manitobans per dose available. What is your comment on what appears to be the slow start that we're having here in Manitoba?
Well, our rate limiting step is the vaccine we have on hand. So as we receive vaccine, we're getting it out. So this upcoming week, we're planning on administering nearly 7,000 doses. And so that's going to take place, through Monday to Friday. If we did that 7 days a week, we'd still have just that under 7,000 doses to provide. So we are getting the vaccines out, and the rate limiting step is just the vaccines we have on hand.
From the Canadian Press, Steve.
Good afternoon, Dr. Roussin. I'm hoping for an update on where things stand with the NHL's plan to return to play. Is Manitoba approving the plan at this point? Are they close? Are there what are the outstanding issues?
Yeah, and so a while back, a number of weeks back, I was signatory to a letter providing my support for the protocols that the NHL had put forward, and from a public health view, this posed a very little concern to the health of Manitobans, and so I was a signatory of that letter. As far as approving at the province level, it's really will be something that we discuss specifically as we amend these next orders.
And the NHL bubble plan was different in the spring. It seemed to be very successful, especially compared to other Major League sports that had travel. What might be in place if this plan is approved and goes ahead? What might be in place to protect frontline workers, hotel workers, restaurant workers, people who might come in contact with the players and might be that link between whatever bubble might exist and the outside world?
Yeah, so there is a very robust plan in place that we reviewed at each provincial level as well as nationally. So the plans are quite robust. They include very frequent testing throughout the season. So as far as a review of everything in those plans, the risk to the public is quite low.
From CTV Winnipeg, Michelle.
Happy New Year. I'm wondering at what point will vaccines be given to people who aren't either a personal care home resident or staffer or a healthcare staff? Do we have any sort of gauge as to how long that might take?
It's the supply that we receive is becoming more stable, but often there are some changes over time, and so it really depends on the uptake with the cohorts that we start with first. So right now we're focusing on those on the higher risk healthcare workers, and like you say, we're moving into the personal care home. So it just a lot of it depends on how quickly we can get through through those higher risk populations, and that depends largely on the receipt of product. So it's difficult to know for sure when we'll do that. We're looking at different strategies even right now in the near future to offer vaccine to higher risk groups within the general population. So we'll have more to come on that, but a lot of this is changing daily.
Okay, and also there were still about 2,000 open vaccine appointments for people who are eligible. Is there any update as to how many of those remain open?
I don't have an update at this point. I think there'll be a memo, a bulletin released later today about 3.
From City News, Mark.
Good afternoon. Going back to looking at Manitoba provincially in terms of how we are doing getting the vaccine into the arms of our citizens, I'm wondering if you can just clear up how many vaccines we have on hand and how many we have administered so far.
Yeah, I don't have the details on how many we have on hand. We've provided, as of yesterday, roughly 3,400 doses. We're looking at about 7,000, a little under 7,000 this week. And so, as we get the doses in, we have plans to get them into people's arms.
Thank you. Wondering if you maybe would have a comment on government staff that traveled over the holidays. Just your perspective on that and what your feelings might be for those who chose to leave the country.
Yeah, and so again, I'm not going to comment on specific situations. I think our messaging was, to avoid non-essential travels. Certainly the international non-essential travel, and so that would be my message to to anyone is to right now is not the time to travel internationally, especially for non-essential reasons. So that would still be my message at this point.
From CHVN, Taylor.
Hi. Good afternoon. Along the same lines, Dr. Roussin, can you share with us just how you spend your holidays, particularly that Christmas weekend, and why?
Yeah, for myself, I was mostly at home. I think I left a couple times to do some grocery shopping. I was also spent some time in clinic over those holiday periods, but I celebrated virtually with other members of my family on Christmas Eve and Christmas Day.
And over the weekend, we had warm weather. We were seeing large groups of people outdoors. Can you explain a little bit more about what is and isn't allowed and who's responsible to monitor that group sizes remain small?
Yeah, and so right now our group sizes, both indoor and outdoor, are 5. And so that means the groups are really people who have come with the same intention to gather. So you may be could be at a rink, and you're there with 3 or 4 of your friends, and somebody else is there with 3 or 4 of your friends with no intent on gathering together. Then that can certainly occur, and can extrapolate that to any settings. We just want to avoid the large group sizes all together, spending a lot of time even outside. As far as who's responsible, it depends on the situation. So I think there's a level of reasonableness for somebody who has a venue that's outdoors to ensure that there's some reasonable fashion to ensure there's not large groups gathering. And then the burden is also on the individual to ensure they're not themselves in large groups.
From the Winnipeg Free Press, Katie.
Good afternoon. I have a question related to the spread of the virus in personal care homes and hospitals. What is being done to mitigate the risk of using the hub model with workers going sort of wherever they're needed, when they're needed, whether that be going into hospitals, care homes, community health settings? What's being done to try to mitigate that risk?
Well, there are public health orders looking at personal care homes so that people don't travel and work between personal care homes when at all possible. However, if there's a staffing situation, we may have to look individually at the PCHs to ensure that they have enough people available to provide care to the residents. For the most part, staff can go work in other areas, be redeployed. The expectation is that they would wear the PPE that's available to them in whatever situation they go in, whether it's a red zone, an orange zone, or a green zone, and take the necessary precautions, including if they become symptomatic, get tested, or if they're a close contact, be isolated as necessary.
Okay. We heard a bit about the asymptomatic testing pilot project in those 3 personal care homes. Can you provide an update on that project, and can you say whether asymptomatic testing will be expanded in the province?
Yeah, I do have the last update I have is as of December 30th. So the 3 sites, there was a total of 511 asymptomatic testing provided to the staff. 86 at Country Meadows, 296 at Deer Lodge, and 1 at Donwood Manor. And the positivity number of positive cases remains the same as it was previously. Just 1 has been identified so far, and 1 was invalid. So yes, we had said that was going to be a 3-week pilot, so I think we have another week to go to evaluate it, and I know the team is looking at how do we expand and spread that further to other PCHs. And we'll give more details on that as they become available.
From Global News, Brittany.
Good afternoon. Happy New Year. Dr. Roussin, I want to go back to the vaccine immunization clinics and the open slots that we're still seeing. There were, as of yesterday, 2,000 open slots for vaccinations this week, and we're still hearing from some healthcare workers that they're having a really difficult time actually booking a spot. Can you tell us how the system is working currently and why we're still seeing these openings?
Yeah, I think that the system from our reports has improved over time, and we're going to continue to find ways to ease that booking. I think that there were still some slots open, and we're just working on it to gradually increase the eligibility. So as we see cases open, we'll widen our eligibility criteria to be able to fill those up. So we're not going to, let it affect our pace of immunizations. We're set to have 7,000 or roughly 7,000 administered this week, and we expect to do so. If there's slots open, then we'll adjust our eligibility criteria to ensure they get filled.
Thank you. And I know that we heard a little bit over the holidays of some people not showing up for their booking. What kind of contingency plans are in place to make sure that if somebody doesn't show up, that a shot doesn't get wasted, or that we can make sure we continue to fill those slots?
Yeah, I think this is an issue with any type of vaccine program, and so there are ways of trying to reach eligible people in the short term if there were last minute doses available. We know that in any vaccine program there's going to be some doses that go unused, and so far this has been very small as far as vaccine programs go. And so there's a lot of planning that goes in to ensure we're effectively using as many doses as we can and getting those doses out as quick as possible.
From the Brandon Sun, Michelle.
Good afternoon. First question, are you or will you be tracking the refusal rate for this specific vaccine in the province? And what do you now know about that in terms of people not wanting it?
So a refusal rate is difficult because it's just we're offering it to cohorts of people, and so we certainly record the amount of people who take us up on the vaccine. Right now, it's very early to comment on any of that. We have sort of still strict eligibility criteria. We've only been doing this for a number of weeks now. And so over time, we'll be able to get a better sense of the uptake in various cohorts, such as healthcare providers and even in specific areas. But it's really early to comment on that right now.
Okay, thanks. I'm wondering also, what work is the province doing regarding long-term effects of COVID-19 in people who are considered, in the recuperated category? And what are those long-lasting effects that you're seeing or tracking?
Yeah, and so right now, public health is not making any of those conditions reportable. So public health isn't following that on the clinical aspects of that. There, certainly as reports in the literature, this is a multi-organ system condition with inflammatory components. So there are reports of long-lasting effects in many organ systems, including neurologically, cardiac, respiratory. Certainly by far, most people who recover do so fully from it. So this will be something that will be, tracked clinically, but public health doesn't have any stance right now to make that a reportable issue.
From CBC National News, Cameron.
Good afternoon. Happy New Year, everyone. Just a question, just kind of checking back in. Dr. Roussin mentioned earlier in the call about, expecting phone calls from other area codes for people that are being contact traced. As for people that have a positive test and are at home, should they still be expecting a phone call from to basically check in on a daily basis, or have we gone past that now?
Yeah, well, we still do active monitoring. It's not necessarily every day, but we do monitor both cases and contacts in that regard to follow up on their condition, also to ensure that they're maintaining self-isolation appropriately. So there is that active monitoring that takes place.
And just switch gears a little bit on that one. In terms of the Moderna vaccine and getting it into remote communities, do we have it yet? Have we taken receivership of it yet here in the province? And has that distribution started already?
So Moderna is in the province, and we have 5,300 doses set aside for the remote communities. They're not, at this point, in community. We're working with the clinical leadership that's appointed by First Nation leaders to see how we're going to disseminate those doses.
Thank you. We have time for just a few more questions this afternoon. Please proceed.
Dr. Roussin,
Dr. Roussin, do you know when we will get the new health orders?
Dr. Roussin, could you please comment on the large numbers of people skating at the forks and on the rivers, clearly above the 5-person limit?
Well, again, comment on it specifically. What I would say is that if there can be much more than 5 people on a river at the same time, just as long as they're not there together and spending time in close proximity. And so if there were large groups that were meeting up and outdoors with the intent of gathering and spending time, that's contravening our public health order, and so I'd suggest people limit their group sizes.
Dr. Roussin, do you know when we will get the new public health orders, so when people can look over them and provide feedback to the province? Is there a point this week when people should be expecting those?
Well, I mean, I think it's going to be this week. They expire on the 8th. And so we'll have to have the orders in place for the 9th. So, but I can't give you a specific timeline on that.
Dr. Roussin, has the province staffed up its vaccination teams for the personal care home vaccinations yet?
They have a plan on that, and yes, they have teams that will be responsible for providing those immunizations.
Dr. Roussin, how come we can't get any additional information about the either Moderna distribution to First Nations 4 days after the vaccine arrived, or the personal care home plan 4 days after Dr. Atwal spoke about it first?
Well, the plans for the First Nations are being worked out, and we've are working in concert with First Nation leadership and the clinical leads that they've appointed. So there will be more information on that, but that's where that is at. As far as the personal care homes are going, there's plans well underway for that. I'm just not sure on what the specifics of those are going to be shared. And so, Dr. Reimer will be out here on Wednesday, and so hopefully we'll be able to provide a more detailed update on some of that anyways.
And there was a lot of work that went on over the weekend with regards to the personal care homes. And I believe the task force is meeting with the personal care home operators as well as the incident command team to work through what the goals are and any details. And following that, I think we'll be able to share much more publicly. We just have to work out those last minute issues.
Dr. Roussin, it's been repeated a few times over the previous week or so. Vaccinations are hoping to get up to 40,000 in January or 10,000 a week. You're now saying 7,000 this week. Do you know when we expect to be able to get up to 10,000 a week this month? Should that be next week, the following week? When should we be able to kind of hit that pace to get to 40,000 in January?
Yeah, I mean, I think that the numbers, certainly in the recent past have been changing daily, and so it's really on the amount we receive. We're not setting aside those doses, for the second dose. We're still in a 2-dose protocol, but we're not setting aside doses for that. We are setting aside that sort of that safety stock. But as far as the specific amounts being shipped to us, I don't have that right in front of me.
Time for one more question.
Dr. Roussin, are you aware of anyone getting the COVID vaccine who doesn't fall into the prescribed criteria, whether that's unintentionally or otherwise?
I'm not aware of any specific situations like that, no.
Thank you. This concludes our media briefing.